CAR T therapies have been in use for several years now. As a clinician, what challenges are you facing with this treatment option?
Absolutely. So would say threefold is the best way to describe it. So I think the first and most practical, like the most important one is obviously access. It's very easy for me to talk about CAR T therapy. I had the privilege of working at a big center where, I was just last week attending on our CAR T service. We're big enough to have a CAR T service. Most patients are treated in the community and they don't have access to a doctor who's personally familiar with CAR T. And so for them to get to CAR T requires a move to a big academic center, a big tertiary care center. Obviously, I think this talk is geared more towards a US audience, but most of the world has no access to CAR T, period, except for research protocols. And that makes things really tough. So I think that's one unmet need in general, where those patients who cannot get to CAR T never see me. And that's a big disparity in the field. Two, I would say that the autologous CAR T products we have, autologous is the word that we use for the T cells are coming from the patient themselves. Both Abecma and Carvykti, again, is the patient's own cells that are being taken out, turned into CAR T cells, and put back. That manufacturing process takes time. Typically, I tell patients to expect about 1 to 2 months, closer to 2 months often, between the day that the T cells are taken out and the day they're put back in again, what we often call the quote unquote vein to vein interval. And that's hard because for some patients that's not practical. The myeloma is, so aggressive, behaving aggressively that they cannot wait. There's no drug I can give them where I can wait 2 months for the T cells to be manufactured. We're getting better at it. The drug company is working better at it. There are a lot of investigational products that are not FDA approved yet that are looking at rapid manufacturing, where can you grow these T cells into CAR T cells in 2 days or one day instead of several weeks. And I think that's really interesting. There are studies of allogeneic CAR T cells where the T cells are pre-manufactured from a healthy donor and manipulated so they won't cause any other problems but will attack the myeloma. So a lot of research happening there, but that's the problem for patients where they cannot get to CAR T therapy. And I think the third unmet need would be, I'm seeing more of this, unfortunately, right? CAR T therapy is not considered curative for myeloma. Have I met people who are doing great years out from myeloma? Yes, from CAR T therapy, and I love that. In the original Legend 2 study, the study that led to the CARTITUDE-1 study, that led to the approval of cilta-cel, which is Carvykti, if I recall correctly, about 20% of patients on that first Chinese study years ago are alive and disease-free 5 years later.
Mm.
That's not enough, right? I don't want it
Yeah.
to be 20%. I want it to be 100%. And so we have work to be done there in terms of what do we do when the myeloma, the CAR T cells stop working or they're out of the system and are no longer there to fight back. What do we do next? And I think that's another unmet need still.